So my personal experience with the MibaFlow is pretty neat and pretty cool. So I've always had dry eye my entire life. I was the kid to be sitting in meetings with the bank that I used to work for, any of that kind of stuff, and my eyes would start watering, and it wasn't because I was crying, it was just because I didn't have enough of that oil layer, and so the water was just pouring all down my cheek. And it was very awkward and not very fun. So when I was going through medical school, I nerded out on every book that I could about dry eyes. Read up, and tried to find the solution, tried to figure out how to fix my dry eye problem. You name it, I tried it while I was in school. And so whenever I got out of school, I was a little jaded. Nothing had really worked very well for me. Some things were just small band-aids, but didn't really help my problem a whole heck of a lot. So whenever I first got introduced to this piece of equipment, I said, all right, great, do one eye. Let me see what it's like after a couple of hours, a couple of days, and then we'll see if I notice anything to try the second eye. So I did one eye, went back to work, seeing patients, and about 2 or 3 patients later, I was like, no, we have got to do my other eye right now because this is absolutely amazing. I absolutely love it. It helps me out so much when I'm in windy environments. My eyes don't have that stinging, burning sensation. My eyelids feel lighter whenever I'm blinking, and it's just so much smoother in that transition of a blink whenever I have it. My world is a little bit clearer also because our tear film does a whole heck of a lot for the clarity of our world. And so when it gets stabilized, our vision gets a lot more stable. And so it has done wonders for my dry eyes, which is why I'm so excited that I have it here in clinic now to start using on some patients as well. I'm Dr. James Therian with the Eye Doctor Near Me channel, where we talk about eye care products, eye care, vision, and vision related products. If you've yet to subscribe to our channel, make sure to do that now. So now the MibaFlow is about 5 years old technologically, but it is gaining a lot of traction and moving across the country pretty rapidly. And so if your town or area doesn't have one yet, don't be surprised at all if you don't have access to one within the next couple of years type deal. Basically, like I said earlier, it does wonders for dry eye, and it touts about a 95% success rate at helping with dry eyes and a 95% success rate as far as patient satisfaction is concerned. So the number one cause of itchy eyes isn't allergies actually, it is dry eyes. And so if you've ever noticed watery eyes, or if you've had artificial tears or eye drops put in where it felt good for a couple of minutes, maybe 2, that is where this product will help out a whole heck of a lot. So essentially we have 3 layers to our tear film. We have a mucus layer that's there to fight off infection, we have a water layer that's there to make the eye feel moist and good and happy, and we have an oil layer that's there to keep the water attached to the eye. If you're not making enough of that oil layer, then instead of the water staying attached to your eye, it's either evaporating really quickly or running down your cheek. Now the way we naturally get that oil layer is by blinking. When we blink, we milk the 30 glands in our upper and lower lid so they can secrete their oil-like substance like it's supposed to. Now if we're sitting behind a computer or any electronic device, we don't blink like we're supposed to. That's where we get kind of behind the 8 ball, and the dry eye is becoming such a massive problem for the US society. So the MibaFlow uses high-level heat and ultrasonic gel to gently massage the eyelids. I tout it as kind of being like a spa treatment for the eyes. It feels absolutely amazing when it's being done. And so it gets in there, and that heat will get into those meibomian glands and into those ducts and start to melt those dried up hardened lipids in meibum so that they can start to get flushed out and cleaned out and start letting the eye do its job like it's supposed to. Now the treatments do not last forever. Depending on how long you've had dry eye is going to kind of determine how long it's going to be until you have to need a retreatment. But typically the way it works is the more length that you've had the dry eye problems, the shorter it's going to be between each treatment. But typically we'll do one treatment, it'll feel good for 3, maybe 5 days, and then after the second treatment, it'll feel good for 7, maybe 10 days, and then after the third treatment, it'll feel good for about 3 months. So typically we'll do a treatment every other week to get 3 treatments, and then at that point in time, we'll do one every 3 months. Now there's no problem with doing more often treatments. You can do it more often, and if you try to stretch it out a little bit longer, sometimes people can do that, but occasionally if we stretch it out too long, we may have to do those 3 treatments again to get back up and running. Basically, it's flushing out those glands, and we've got to get everything flushed out before we'll be able to get to go that long term.